Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the case study knowledge check. A patient with the hypothyroidism comes to you and requests a switch to Armor combine T4 and T3 thyroid because she was told it was more natural and better than the levothyroxine. You tell her yes, it has been proven to be better. There is clear proof that patients don't like it. Some patients prefer it, but there is high risk of TSH suppression and monitoring is needed. A combination of T3 and T4 separately is better. A patient with the hypothyroidism comes to you and requests a switch to Armor combine T4 T3 thyroid because she was told it was more natural and better than the levothyroxine. Some patients do prefer combination therapy. There is no clear proof or the superiority in blinded study and there is a greater risk of TSH suppression. T3 or dissected thyroid should not be used in pregnancy. T3 and the T4 pharmacology. Thyroxine T4 half-life is 7 days. Stable the long-acting intestinal absorption of oral T4 is the 80%. Their hypothalamus pituitary TSH T3 T4 ratio is the 1:13. Thyroid gland 93% T4 and 7% T3 produced by the liver and muscle. T4 half time is the 7 days and stable long acting intestinal absorptions of oral. T4 is 80%, half life is 0.75 days. Onset of action is 2 to 4 hours. Rapidly absorbed. Mark the blood level fluctuations. May falsely suppress TSH if taken close to blood work. Next is the treatment of the primary hypothyroidism. Goal to normalize TSH. T4 levothyroxine synthroid drug of the choice. Generic brand name bioequivalent but altered by availability reported. Full replacement dose usually about 1.6 mcg per kg. Absorptions more complete and less erratic in the fasting state. Patient advised to take LT4 tablet in morning or late evening. Some patients don't need full replacement at first. Never were wrong to start the low and titrate up. Careful in the CAD. Elderly start with the lower dose 25 to 50 mcg per day. Avoid taking with iron calcium impairs absorption. There are the dose titrated up to normalized TSH. Recheck the 6 to 8 weeks after dose change and 6 to 12 months thereafter. So in today's class, I discuss about the treatment of the primary hypothyroidism. Thank you for watching.